The Gambia is poised to begin the second phase of its nationwide polio vaccination campaign, running from December 12 to 15, 2024, spearheaded by the Ministry of Health's expanded program on immunization and supported by key health partners. This critical initiative aims to protect children across the country from the devastating effects of polio. At a press conference on Wednesday, the ministry shared details about the campaign's goals, strategies, and significance. Polio, a debilitating virus primarily affecting children, can lead to paralysis or even death, but it is entirely preventable through vaccination. The ministry emphasized that this initiative is aligned with the World Health Organization's protocols for polio outbreak response and global health regulations. The program manager for the ministry's expanded program on immunization, Siddharth Fofana, expressed gratitude to parents and teachers for their support during the campaign's first round, which was deemed successful. Reaffirming the ministry's commitment to eradicating polio in the Gambia, Fofana underscored the importance of collective action to safeguard the nation's children.
We are fighting a disease. We cannot eradicate the disease if we are leaving people who are not vaccinated. And this is because some parents are not clear. This is the same polio vaccine that we normally get at the health facilities. So we got this one because it's a specific type of virus. If we allow it to spread, many children will be paralyzed in this country. Many children will die. And it will not stop there. It will even affect men. That's what happened to some of these vaccine-preventable diseases. If you allow them to come back and hold a grip on your nation, children are affected. It will go for the elderly, you and me. We will be paralyzed and we will die. So this is why anytime you have this campaign, always understand that because the life and health of millions of people are at stake, that is why the global partners will always get up and make sure that these things don't happen anywhere in the world. So we have done first round. We are preparing for the second round. And then we want to have a better coverage than the previous one. We know we have certain few issues, and definitely we have done very much to make sure that we are able to ameliorate or even prevent some of them at all. We realized that the last time we have been doing campaign in this country, major campaigns, frequent one were around 2014. So from 2014 to now, we have seen a lot of development. So many growth centers came up, in the Kanifing, in the Combo North, in the Combo South. So as a result, we realized that we need to boost the number of teams, and that we have done.
Program Manager Health Communication Unit, Directorate of Health Promotion and Education at the Ministry of Health, Mas Juve, clarified that the vaccination drive is open to both citizens and non-citizens residing in the Gambia.
Luckily for us, this is not going to be that much lengthy or that marathon, as we've already gone through the first round and we saw how much you guys were able to really get this information and disseminate it to the general public for their consumption, and to pay heed to know that this campaign is not only for the Gambians but those resident in the Gambia, and to ensure that our interest is to make sure that every child is protected, 0 to 5 years. And in this case, we believe you're going to repeatedly do the same thing by ensuring that people get the information at their doorsteps.
Communication Officer of the expanded program on immunization, Bayang Jom, explained that this time the polio virus was detected in an environmental sample collected from Banjul.
The polio outbreak was declared in July this year by through environmental sample, and of course it's also another golden sample collection that we do to test the polio or AFP, because what we do is we had the AFP surveillance that we collect stool of children that had polio, or we collect the environmental sample, and this time the virus was isolated in an environmental sample that was collected from the Banjul point. Still on general information on polio, It's currently an outbreak and needs to be contained, and otherwise it can infect and paralyze more children and spread to neighboring. And before it even goes to the neighboring countries, it goes from person to person, despite your age. And when it comes to vaccination, it's the most cost-effective public health intervention at all times. So it is very important for our kids, especially those under 5, to be vaccinated.
This discovery follows a ministry statement in July that announced the detection of a new polio virus strain during environmental surveillance, leading to an official declaration of a polio outbreak. As the second round of vaccinations commences, the Ministry of Health continues to call for public support to ensure the campaign's success, bringing the Gambia to one step closer to a polio-free future. Reporting for Kerfatu, I am Buba Gajigo.